Hello everybody. So last night I had supper at Jacques dans la Bois. As many of you know, I'm sure you think it's a very fancy French restaurant. But in reality, Jacques dans la Bois is just a French word for Jack in the Box. So the reason I'm using this analogy is, I have patients come to me for whatever procedure and they say, well, do you do this or that? The most common thing obviously is a 360 lipo. 360 lipo, if you read about it, is just liposuction of the abdomen, the flanks, which is the love handles, and the mid and the upper back. So the entire back, love handles, and the abdomen. We've been doing that for 40 years. Unfortunately, in very competitive markets, and I think the doctors don't have any choice. They have to come up with something to make themselves stand out. So these doctors come up with these fancy marketing terms to try to bring patients in. But, remember, there's so much we can do with the body. At the end of the day, you can call the procedure whatever you want, but we're limited by what can be done in the body without killing the patient or doing something really bad. So keep that in mind. There's a limitation what can be done. If your bone structure is a size 6, that's your frame, and then everything is based upon that frame, no liposuction is going to make you a size 2. I can get some kind of fancy facelift with a fancy name with the best surgeon in the world. I'm not going to look like Tom Cruise. There's a limitation what can be done. Now, if I look like Tom Cruise and everybody told me I look like Tom Cruise, well, yeah, then I'm going to look more like him, but there's nowhere to look exactly like him. And even if you look at nature, because after surgery, a lot of the patients look at themselves more critically and they want that perfect symmetry. If you look at nature and identical twins, so what happens is the sperm and the eggs get together and then the egg splits, right? So this is exactly the same genetic material. You basically copied that. It's the same thing. But if you look at identical twins, and if you look at them very critically, like some of you do after your surgery, you will notice that there's differences between them. And once you learn them, you can easily tell them apart, even though they're very, very, very close to each other. So remember, in terms of techniques, I think we've pretty much reached the limit of what we can do with the technology that we have. Now maybe in the future with stem cells and this and that we can really transform patients. But any new technique that comes is a minor variation of some other technique. And most of these, if you look at the history books, will probably describe what somebody, we just never bother to do the research. Don't let these terms, the most important thing is the doctor. The doctor needs to know what they're doing, and they're picking the right patient. They're making sure you're medically stable and you have realistic expectations. Look at the before and afters. I always tell patients, if you don't like my before and afters, please go to somebody else. I won't get offended. We all have different visions and different expectations, so make sure you and your surgeon are on the same wavelength. All right? So go out there, go to Jacques dans la Bois for dinner and have a fancy dinner on me, all right? Take care and be safe.